Hi, this is Pat Johnson, your psychology instructor, and in this mini lecture, we're going to talk about the psychological disorders category called anxiety disorders. We're going to focus on generalized anxiety disorder, panic disorder, and phobias. Now, anxiety can be good. Having an anxiety disorder isn't good. So let's say that you're sitting in class and a lion comes into the room. You need to have some anxiety. You need to have your body trigger that fight or flight response automatically and get away from that lion so that the lion doesn't kill you or harm you. An anxiety disorder, on the other hand, is not good. When we have an anxiety disorder, we have a psychological disorder that is characterized by distressing, persistent anxiety, or maladaptive behaviors that reduce anxiety. So anxiety disorders are very distressing, and it's not just one situation for a short term. We're talking about something that is persistent and something that is bothering the person for a long time. So this is really distressing. Okay, let's go on to our first anxiety disorder and talk about the least flashy but a very commonly diagnosed anxiety disorder called generalized anxiety disorder, often going by the acronym GAD, generalized anxiety disorder. If you were to have generalized anxiety disorder, you have an anxiety disorder where the fear is continual. It's a low level, and we use the term chronic when we're talking about GAD because this is a low level of fear that's fairly continuous where the person is worried about numerous areas of life. So it's not being afraid of one thing. It is chronic worry enough to influence your life, to influence your adapting to life. And the person could be worried about money, they could be worried about grades, they could be worried about relationships, they could be worried about their job. They are chronically worrying. And if you remember that term, autonomic nervous system, that's where that fight or flight response comes in. So the person is in a low-level chronic state of worry all the time, and it's affecting them physically. Let's contrast generalized anxiety disorder with panic disorder. This anxiety disorder is marked by unpredictable minutes. So while generalized anxiety disorder is chronic, panic disorder has these acute meaning short-term, acute episodes of intense dread. The fear here is really, really intense. It's off the charts. And so the person is experiencing terror, and it's very physical. So they could be having chest pain, choking, other frightening sensations, and then they start worrying about the next attack coming. And so the person with panic disorder really often finds himself being diagnosed in the emergency room, or at least a referral being given in the emergency room, because the first panic attack, well, it often feels like a heart attack. And the worst thing that can happen is somebody saying, oh, it's just in your head. Well, for the person who's experiencing it, that panic attack is very, very real. It's very distressing. It's extremely acute. Now, the last disorder we're going to talk about in the anxiety disorder category are the phobias. And most of you know what a phobia is. It's where you're scared of a particular thing or situation to a really huge extreme. So phobias are an anxiety disorder marked by persistent, in other words, this isn't just one episode, but persistent irrational fear and avoidance of a specific object or situation. So it has to be irrational. I mean, if you're afraid of tigers in the classroom, and there really are tigers in the classroom, that's not a phobia, that's a realistic fear. But when we're talking about phobias, we're talking about people fearing things that usually don't cause most people that extreme level of fear and avoidance. And so when we're talking about avoidance, we're talking about the phobia really interfering with that person's life. So you may not like crossing huge expansion bridges, but it's not a phobia unless it starts interfering with your life and you decide, well, I'm not going to take that really good job because I would have to cross a bridge to get to that job, and the bridges are just too scary. Now, we have three categories of phobias. We have specific phobias, where the fear is of some situation or thing that is very specific. We have agoraphobia, and we have social anxiety disorder, which used to be called social phobia. So let's go to specific phobias first. In specific phobias, as I said, the fear is to something very specific. So it could be arachnophobia, where people have a huge fear, an unreasonable fear of spiders. Now, most people don't like spiders, but if you decide that I won't go outside of my house in the summer at night because there's just too many spiders, and I'm not going to go visit friends or anything, then we're talking about more in the realm of arachnophobia. And this is a very common phobia to have. You could also have claustrophobia, where the fear is of enclosed spaces. And then a lot of people also have fears of clowns. And all three of these are common phobias, and there's lots and lots of specific phobias. You could have a fear of heights, you could have a fear of water, you could have a fear of dogs. There's just all sorts of specific phobias. When we're talking about agoraphobia, agoraphobia literally translates to fear of the marketplace, but it doesn't mean that so much as fear of being in a place where you feel unsafe and that you may panic. So we often find agoraphobia and panic disorder going hand in hand. And here's what usually happens to the person who is agoraphobic. Let me give you the example of Black Friday. Black Friday is the day after Thanksgiving, where usually stores have really good deals and a lot of people go out and shop on Black Friday. Well, let's suppose our person has a panic attack in that very crazy situation at, let's say, Walmart. And so they start avoiding Walmart, and their world just got a little bit smaller. Or maybe they just decided they're not going to do Black Friday. And then they decide, you know what, it's not just Black Friday, it's big, busy stores. So I'm going to avoid payday at big stores. And then I'm just going to start avoiding big stores. And then I'm going to start avoiding anything but convenience stores, little mom and pop stores. And then I'm going to stop leaving my neighborhood because it's just too big. And then I'm going to stop leaving my block. And then I'm going to stop leaving my yard. And then I'm going to stop leaving my house. So we see this shrinkage of the world for the person who has agoraphobia. And for people who have agoraphobia in a very severe way, it's almost like being under voluntary house arrest, where they just can't leave because they're so afraid of having panic when they're out in public. The last phobia we're going to talk about is social anxiety disorder. And again, this used to be called social phobia. But in social anxiety disorder, it's not so much being shy as the fear of being evaluated by other people. So I have a lot of students who won't take a class where they have to give a speech because they're so afraid of speaking in front of other people. And if that's really starting to interfere with their life, then they have social anxiety disorder. It could also be that the fear is not so much giving speeches, but let's say driving with other people in the car. They fear other people are going to judge them. And again, that's the main characteristic of social anxiety disorder, is that fear of evaluation. So we've talked about generalized anxiety disorder. That's the chronic one of low-level anxiety about numerous areas of life. We talked about panic disorder, where there are these short bursts of extreme panic. We call them panic attacks, and they're very physical, they're very intense. And then we went on to phobias, talking about specific phobias, agoraphobia, and social anxiety disorder.